My name is Ellery. I'm a breast cancer nurse navigator at Compass Oncology, and my job is to guide patients through their breast cancer journey from the date of diagnosis through to survivorship. Getting a diagnosis of breast cancer is really hard for women because it affects a lot of things that we associate with being a female and being a woman. The word chemotherapy, women think, I'm gonna lose my hair. Am I gonna lose my hair? Yes, you are. You know, any chemotherapy regimen that your doctor is gonna prescribe, you're probably gonna lose your hair. Hair loss is not just vanity. And I've had this conversation with countless women that they are embarrassed to tell me that they don't wanna lose their hair. And it's not something to be embarrassed about. It's legitimate. It affects your self-esteem. It can affect issues with anxiety and depression, especially going through chemotherapy, which is really hard on its own, let alone losing your hair and thinking that the world perceives you as being a sick person. The Paxman cooling cap provides women an opportunity to save their hair. When I tell patients that there's a way that they can save their hair, it sounds kind of weird at first. I say there's this cold cap that you can put on your head and you wear it throughout treatment. It looks kind of funny, but once we kind of start discussing what the product does, patients are either very interested and motivated to use it, or they already know what they're gonna do. They plan to be bald and beautiful, and either way, it's a really personal decision, and I think women kind of have an idea of what they want to do coming into it. Paxman cap is a device that unfortunately you have to pay out of pocket for, but if you have the means, you can enroll in this and use it. You put it on before you get your first chemo infusion, so in the treatment room. So the cap is cold. When it gets hooked up to the machine is when the coolant starts flowing through the cap, and it kind of gets tighter as it gets cold. It can cause a little bit of a headache, and so taking some Tylenol before you put the cap on is a good idea. And the treatment room nurses have warm blankets that you can keep your body nice and warm while you have your cold cap on. What the cap does is it cools your scalp so that the blood vessels constrict, and it draws essentially the blood and the chemotherapy away from the hair follicles, preventing the chemotherapy from getting to the hair follicles. The success rates are based on women keeping 50% or more of their hair during treatments. So there is still going to be hair loss associated, and sometimes it looks like a lot of hair is coming out. What I see most in clinic is women coming in for follow-up appointments. A lot of them are still wearing caps or beanies, but you can still see that they have hair. You cannot tell that they're going through chemotherapy. They don't look sick. I think that the Paxman allows patients to feel like they have a little bit of control over this disease that has affected their lives in such a huge way and taken away a lot of control.